COPD, chronic obstructive pulmonary disease, is a group of lung diseases that make it hard to breathe and get worse over time. Normally, the airways and air sacs in your lungs are elastic or stretchy. When you breathe in, the airways bring air to the air sacs.
The air sacs fill up with air, like a small balloon. When you breathe out, the air sacs deflate, and the air goes out. If you have COPD, less air flows in and out of your airways because of one or more problems. The airways and air sacs in your lungs become less elastic. The walls between many of the air sacs are destroyed. The walls of the airways become thick and inflamed. The airways make more mucus than usual and can become clogged.
COPD includes two main types. Emphysema affects the air sacs in your lungs, as well as the walls between them. They become damaged and are less elastic. Chronic bronchitis, in which the lining of your airways is constantly irritated and inflamed. This causes the lining to swell and make mucus. Most people with COPD have both emphysema and chronic bronchitis, but how severe each type is can be different from person to person.
The cause of COPD is usually long-term exposure to irritants that damage your lungs and airways. In the United States, cigarette smoke is the main cause. Pipe, cigar, and other types of tobacco smoke can also cause COPD, especially if you inhale them.
Exposure to other inhaled irritants can contribute to COPD. These include secondhand smoke, air pollution, and chemical fumes or dusts from the environment or workplace. Rarely, a genetic condition called alpha-1 antitrypsin deficiency can play a role in causing COPD.
The risk factors for COPD include smoking. This the main risk factor. Up to 75% of people who have COPD smoke or used to smoke. Long-term exposure to other lung irritants such as secondhand smoke, air pollution, and chemical fumes and dusts from the environment or workplace. Age. Most people who have COPD are at least 40 years old when their symptoms begin. Genetics. This includes alpha-1 antitrypsin deficiency, which is a genetic condition. Also, smokers who get COPD are more likely to get it if they have a family history of COPD. Asthma. People who have asthma have more risk of developing COPD than people who don't have asthma. But most people with asthma will not get COPD.
At first, you may have no symptoms or only mild symptoms. As the disease gets worse, your symptoms usually become more severe. They can include frequent coughing or a cough that produces a lot mucus, wheezing, a whistling or squeaky sound when you breathe, shortness of breath, especially with physical activity, and tightness in your chest. Some people with COPD get frequent respiratory infections such as colds and the flu. In severe cases, COPD can cause weight loss, weakness in your lower muscles, and swelling in your ankles, feet, or legs.
Your healthcare provider may use many tools to make a diagnosis. A medical history, which includes asking about your symptoms. A family history. Various tests, such as lung function tests, a chest X-ray or CT scan, and blood tests. Your doctor will diagnose COPD based on your signs and symptoms, your medical and family histories, and test results.
There is no cure for COPD. However, treatments can help with symptoms, slow the progress of the disease, and improve your ability to stay active. There are also treatments to prevent or treat complications of the disease. Treatments include lifestyle changes, such as quitting smoking, avoiding secondhand smoke, and healthcare provider recommended nutrition and physical activity plans. Medicines, oxygen therapy, pulmonary rehabilitation, and surgery. If you have COPD, it's important to know when and where to get help for your symptoms. You should get emergency care if you have severe symptoms, such as trouble catching your breath or talking. Call your healthcare provider if your symptoms are getting worse or if you have signs of an infection, such as a fever.
Since smoking causes most cases of COPD, the best way to prevent it is to not smoke. It's also important to try to avoid lung irritants such as secondhand smoke, air pollution, chemical fumes, and dusts.